Hey guys, so for this video we chose to focus on a nurse's role in palliative and end-of-life care in children with special healthcare needs. End-of-life care for people with special needs is particularly challenging due to their limited level of understanding and communication difficulties.
The article we found is titled From Activating Towards Caring: Shift in Care Approaches at the End of Life of People with Intellectual Disabilities, a qualitative study of the perspectives of relatives, care staff, and physicians. The objective of this study is to increase nurses' knowledge about end-of-life care for people with intellectual disabilities.
In summary, the goal of end-of-life care is essentially to have two families, one being the relatives and the other the care staff. They come together and jointly provide care for you as a dying person with disabilities. This can lead to warm, loving care in the proximity of the very people who are most important to you and who know you and your needs best.
So an example of this shift in care is seen here in this scenario. This is 10-year-old John. He has severe cerebral palsy, and in the past few weeks his condition has declined, and he's now been put on palliative care in the hospital. This is Nurse Ivy talking with John's mom, Corey. The two have come together to provide the best end-of-life care for John. This article highlights 5 key shifts that the nurse and family must make in order to provide the best care for patients at the end of their life. This includes adopting new care strategies, and instead of focusing on tasks that they need to complete, it's more focused on comfort and recognizing their distress signals and pain. It's also more focused on bringing the two families, the care staff and the actual family, together in support for the patients.
As John's primary nurse, one change that I've had to make as we've transitioned to palliative care is last week, for example, we were focused on, getting him ready for adult life and preparing for those life skills, taking him to OT and PT. And with the deteriorating condition, our focus now is on care and making him feel loved and comfortable in his last few weeks.
And as the mom of John, I've noticed this change and shift of care. They're really focused on just making sure he's comfortable, and that's really comforting to me as the mom to know that yes, he is deteriorating and his condition is worsening, but we know that he's being taken good care of and he's comfortable. They also have been a big help to me and my husband. They've helped to take off the load of medical responsibilities, helping us to feel less stress in this trying time that we're in right now.
So like the nurse and the mom said, there are no musts for the patient anymore. It's more about letting go, letting them have a final last few weeks, letting them snuggle in bed, letting them rest, watch their favorite TV show. They don't have to sit up if they don't want to, and if they don't have the power to do so. Next, the article highlighted a few core values that facilitated the shifts in the nursing staff. Some of these values included being there for the person with disabilities, being responsive to their needs, and understanding their expressions of distress. It was also being attentive to the patient and the family, and knowing how to comfort both in their time of need. It's almost being like, I see you in pain. I can help you. We're going to help make these last few days the best of your life.
All right, John, as your nurse, I'm kind of noticing that you're showing signs of being in pain in your facial expressions and an elevated heart rate and respirations, and we want to try to make you as comfortable as possible. Can I get some pain medications for you?
Yeah, I think that'd be good.
Yeah. Okay, I'll go get those for you.
Thank you. John, do you want me to just stay in? We can sit in bed, maybe read your favorite story or watch a movie. Would that be good right now?
So as seen in this scenario that we presented in this video, at end of life, care staff and relatives must alter their care to fit the current needs of the patient.
Yeah, so they need to be less focused on life skills and health improvement and more focused on truly caring for the patient to help with this transition.